So we were really thrilled to be part of this collaborative project. We were involved from the very start, working with Bob, ICB, and the Oxford Severe Asthma Care team to really understand what the key challenges were in improving severe asthma care across the system. We developed a bid that not only integrated severe asthma care into wider respiratory care across Bob, but also addressed some of the critical barriers to improving severe asthma care.
The mainstay of our project, three big arms. Big arm number one, it was trying to get out to 9 PCNs, send out highly specialised pharmacists to search for and find complex, difficult asthmatics, and then fast track them through the hurdles straight onto biologic therapy. Number two, we wanted to kind of get FENO out there a bit more. We historically, where I am locally, we've had a very low use of FENO in primary care, and thanks to partnership with the AHSN, particularly our Oxford team, we're really thankful we were able to have a carrot of offering every PCN that came with us a free machine to take away, and we do some training, and yes. And then number three, we use this to really strengthen our spokes to our secondary care colleagues, and they were the three big aims, all of which was really focused on how do we make sure the asthma patients who really need it get these life-changing therapies quicker, more efficient, better, yes.
A project also enabled us to have a dedicated consultant. We could fast-track any referrals to our specialist tertiary centre. Following all of these interventions, we've had very, very positive feedback from not only patients but also clinicians in primary, secondary and tertiary care. So we knew by then that we did a good job. Our patients were offered 30 to 40-minute consultations, which is a luxury in the current world of fast-paced, general practice reviews. So we could really look after them in a very holistic way, listen to their concerns, and tailor our help in a way that they appreciated. And this is, I think, a biggest win and most rewarding part because we have changed people's lives as they told us, thanks to spending enough time to take their concerns into consideration and then tailoring that intervention that we've provided.
The joy of using really specialised people is that on the way they don't just do that one goal, and so we've had inhaler changes to better inhalers for the environment.
One of the key elements of it is focusing in on areas of higher health inequality. They searched and found about kind of 2,000 patients, and then systematically reviewed down to a number of patients, about 140 odd patients really. They ended up being able to actually come in for a review and then move them through the biological pathway. And I think ultimately for those patients, getting them onto that earlier specialist and tertiary care level review through kind of the severe asthma team at the OUH and working with the team is obviously highly beneficial for the patients, and then ultimately for the biologics suitable candidates, again, get them onto those medications will have a significant impact on their health outcomes and on their quality of life.